So question number one, GAE is exploding all over the world. MSK embolization is exploding all over the world. One of the big questions that we're still trying to answer right now is how we properly identify and select these patients. Is MRI with contrast needed to guide selection for genicular artery embolization? Oz, you got the yes side. Sid, you got the no side. Oz, why don't you start?
Yeah, sure. I'll go first. Okay, so, I think the question relates to patient selection, which is probably arguably, one of the biggest challenges in GAE currently. I think we know that probably roughly 25 to 30% of patients that undergo GAE are non-responders. So we need to probably try to ideally titrate that down even further to figure out who, will best sort of appropriately respond to GAE. So I think, MRI is probably arguably, again, the probably most sensitive imaging tool we have to sort of assess the knee joint, figure out potential predictors of response, things like bone marrow lesions, synovitis, cartilage thickening, cartilage defects, meniscal tears, things like that, which have already been shown in literature, to be potentially predictive. So I'll stop there, maybe let Sid counterpoint.
I agree with the fact that our batting average, let's just say 70% for argument's sake. So that means there's this 30% that has really no response. In an ideal world, we want to be hitting 90%, right? So let's figure out who that 30% is and try to not offer it to those patients, right? And tell those patients up front that, look, this is not going to work. And so can we use MRI as a prognosticator for that? I don't think today we have that. That's a problem. And I think maybe in 5 years we will if more research is done. For example, synovitis on MRI, there's one or two studies showing like synovial thickening or a joint infusion is a negative prognosticator. And then there's others that say it's positive. Same thing with bone marrow lesions. And none of these, unfortunately, are absolute. When we look at the orthopedic surgeons and knee replacement, if you have knee arthritis, and you're going to get a knee replacement, knee MRI is not even standard of care for them. Most patients actually don't get it because all the findings are in a way irrelevant. So I would say we're not there. The one, I think, real big use for an MRI, whether it's without or with contrast, is to exclude other pathology that could be causing pain. So I actually had a guy last month who had a insufficiency fracture. And, when I go back and ask him afterwards, before I did the procedure, how long has your pain been? He's like, the pain is actually different in the last 6 to 8 weeks. So he had, a very different etiology of pain, which is clearly not going to be helped by GAE. So I like to use it for excluding other pathology.
Yeah, I think we'll probably meet in the middle that, MRI is probably not ready for prime time. It's clearly, in some sense, a research tool still to sort of figure out, who's going to best respond. But like you said, there's clearly a gap of people who don't respond, and it doesn't make any sense. You do the angio, it looks like they have, blush, and you do the procedure, and they're like, nothing literally happened.
I agree. I mean, you have these cases, and you're like, this is going to work. And then 3 months later, they're like, it didn't work. And you're like, huh, interesting. So the other challenge is on an MRI, what are we truly looking for? We don't really know. You can look at these scoring systems. There's things called worms and MOCs. And if you actually look these scoring systems up, they're incredibly complicated. I can't do it. You really do need an MSK radiologist to do it. There's like 25, 30 things you're looking on at an MRI. So these things become so complicated, especially when you start going with IV contrast, dynamic post-contrast imaging. In a way, there's only almost too many variables now to look at. And I hate to say the AI buzzword, but maybe one day if there is some data set of 500 or 1,000 patients with MR, that's actually a great application for this to try to figure out who's going to succeed and who isn't.
It's the Guermazzi scoring system that's post-contrast, right?
Correct.